They are telling us, Congressman, the Democrats, that is, that they have enough votes, obviously, and maybe more. Do you believe that? And if you do, how angry are you about it?
Well, I'm not angry by the predictions that they have the votes, but on behalf of the American people, I'm profoundly disappointed. I think millions of Americans have spent the last year trying to let their voice be heard, trying to convey that they don't want a government takeover of health care that mandates that every American has to buy health insurance. They don't want a massive new bureaucracy, job-killing taxes. But Congress and the administration tonight are choosing to ignore a clear majority of the American people and drive toward passage of this legislation. So it's not anger, but disappointment. Right. At what we see coming. But Republicans are still in this fight, and we're going to fight to the finish on behalf of our ideas and our alternatives for health care reform.
How strong is the repeal it movement? And is that strategy going to work?
Well, let me tell you that I don't want to jump past this final vote. We've got a Republican motion on the floor. We're going to be bringing all the heat that we can tonight on this issue. We're continuing to generate efforts around the country to communicate to members of Congress. We'll leave discussions about the aftermath to after the final votes are counted.
At what point do you think you start to see, are we going to see higher insurance premiums as a result of this legislation? And if so, what impact is that going to have when it comes to the next round of elections?
Well, you know, the Republicans on the Ways and Means Committee requested an updated estimate from the Congressional Budget Office with the reconciliation bill and the changes in the Senate bill, and they came back just a day or two ago and confirmed that for many Americans, health insurance premiums will go up, and as many, I think, as between 5 and 10 million Americans will actually lose the health insurance they have and be relegated to this government-run plan.
Why?
If, in fact,
because companies aren't going to provide it anymore? Is that why?
Yeah, well, what happens is that under this legislation, if it becomes law, companies are going to have every incentive to dump their employees and send them to the government-run plan, because that's the way the incentives are built in, and quite frankly, it's in many cases to the advantage of businesses that are struggling in this economy to dump those employees into that plan. Some of the estimates on the House bill were upwards to 100 million Americans could lose the health insurance they have. So, you know, we believe if this does become law, we're going to see a lot of unintended consequences. We're going to see insurance premiums go up. We're going to see lots of Americans, especially seniors, lose the health insurance that they have. And I think, going back to your other question, that's going to create an environment, if this bill passes, for an ongoing public debate.
Representative Pence, thank you so much for joining us on this historic night, whether you like it or not.
Thank you.